Since yesterday's briefing, we have been notified that we have 3,627 more residents who have received positive test results. So that puts our statewide total at 54,588. Again, 3,627 overnight, and our statewide total at 54,588. According to our online dashboard, again, that's accessible through covid19.nj.gov. As of, Judy, I think this is right, as of 10 p.m. last night, we had 7,570 residents reported hospitalized, of which 1,679 were listed in critical or intensive care, and 1,663 ventilators were in use. For the 24-hour period ending 10 p.m. last night, a total of 682 residents were discharged. And so that's an important point to note. You can see up there the hospital, how many folks are hospitalized, how many of that cohort require intensive care, how many ventilators are in use. And as Judy has said all along, that's going to bounce around at about 1 to 1, and it is showing up to be that way. And another piece of evidence that we are at least beginning to see some light here, 682 residents who are discharged, and that's a big deal. Let's flip to a map that we've been showing you from time to time. This is the county sort of heat map, and it measures the amount of days of doubling of cases. And when we first showed this map, it was orange and red would have been the fastest amount of doubling. Orange was a little bit slower. The yellow is slower again. And this is the first day that we have two counties where we are seeing a new color, which means it is more than doubling. It's doubling rather at least 7 days or more. That's Salem County in the southwest, where there are certainly cases. Salem has right now a total of 46 positives and 3 fatalities. And that's good news because that was red just a couple of days ago. So while the caseload is small, the curve was steep. That's encouraging. But even more encouraging is Bergen County in the northeast. And that's the other one that's lightly shaded. And Bergen County has just under 9,000 cases and 390 fatalities. So that's where it hit first. And the fact that that's beginning to show that shade, please God, it continues to. And we get other counties that continue to clock over. Those are good early signs. Again, too early to spike any footballs, but those are two important early signs. As we noted yesterday, we may want to go back to the hospitalization numbers. Do you mind, Mahin? The dashboard pulls data as it is reported by hospitals to the New Jersey Hospital Association. It is just a snapshot. And Judy would want me to remind you of that. This is not a movie. It's a snapshot of a moment in time. Again, because we are here earlier than usual, there may be overnight changes that are not yet reflective in that data. Now, additionally, with the heaviest of hearts, we also know that we have lost another 233 of our fellow residents since yesterday. And that total number now stands at 1,932. Again, 233 precious lives lost, and now a total of 1,932 precious lives lost. Please allow me to just tell a couple of very brief stories about a few of these folks. This picture, bring it up, folks, is Evelyn Sanchez. God bless her. Evelyn and her husband, John, were partners both in life and in their family-owned business, Emergency Pest Control. She is remembered for her tremendous generosity of spirit. She was born in Vineland and called Sparta in Sussex County her home for the past 35 years. She leaves behind her husband, John, president of the Essex County Latino Chamber of Commerce, along with her children and stepchildren and step-grandchildren. I know she will not be forgotten, and she was only, and this is my age, 62 years old. God bless you, Evelyn. Sam McGee, there is handsome Sam, was the first African-American elected to serve as mayor of Hillside in 1988. He was a member of the Township Committee and also served on the Union County Improvement Authority among other posts. Adding to his years of public service was a career as a high school history teacher and 32 years as Dean of Admissions at New Jersey City University. We send our condolences and prayers to his family and friends. And there's also Dr. Francis Molinari of Kearney, who was a physician for 4 decades, tending to his own practice in Belleville, serving on the staff at Clara Mass Hospital, at the Meadowlands Sports Complex, as well as working for 30 years for Hudson County prior to his retirement 2 years ago. To his wife Lorraine, with whom I spoke yesterday, and daughter Andrea and their family, we join you in mourning his loss and praying for his soul. The conversations that I have had with our families who have lost loved ones to COVID-19 are not easy, nor is sitting here telling some of their stories easy for any of us. It's nothing compared to what they're going through, both the folks who have left us as well as their family and friends. And we have to remember them. We must recognize the tremendous toll this virus is having on our state, and seeing these faces and hearing these names reminds us that behind the stark and impersonal numbers are real people, real human beings, real families. And we all have a role to play in reducing the number of people we lose. We have to keep with social distancing. That is the key to cracking the code, flattening the curve, and getting us to a better place. And again, remember, when we flatten the curve of the number of people who are infected, we lower the amount of hospitalizations, the amount of intensive care hospitalizations, and ultimately fatalities. One thing does lead ultimately directly to the other. This weekend is Easter weekend, and I know is one where we are used to gathering together as we do normally at Passover. We gather normally at Easter to worship. We gather for children's Easter egg hunts, for family meals with friends. We can't do any of that this year. I feel awful, but we can't. We have to leave the gathering to FaceTime or Zoom or just simple phone calls and texts and emails to our family and friends. Instead of heading to church, many of us will fire up our laptops for a live streamed service. Staying apart this year is the surest way we'll be able to gather again next Easter and the many Easters to come. So please take this to heart and take this seriously. We all must work together. And if we do, unequivocally, we will come through this stronger as one New Jersey family together. But we each have to do our part. And the 9 million of us need to flatten that curve. Stay home, stay away from each other. Again, that leads to fewer infections, fewer hospitalizations, fewer intensive care unit hospitalizations, and fewer loved ones who we will lose. And you and me and the rest of the 9 million of us will manage this front, while our extraordinary, heroic healthcare workers and our teams represented by Judy and Ed and Pat and others will build out our capacity of beds, ventilators, personal protective equipment, medicines, and certainly relief from the bullpen for our heroic healthcare workers. We win those two fronts together. Those lines have to cross at a reasonable level. And if we keep it up, if we stay with it on this weekend, this Easter weekend, and every day in the near term, near to intermediate term, we will win this together. Switching gears, we know this public health crisis has extended into our prisons. And Commissioner Hicks, and I want to give him a huge shout out, has been attacking it for weeks and will address his efforts in detail in a few minutes in his remarks. The pandemic has touched many of our corrections personnel, just as it has those who are incarcerated. A virus this virulent can spread rapidly in a densely populated prison setting, and the needs of public safety and public health have to be balanced. To that point, I just got off the phone a few minutes before coming here with the widow of Nelson Perdomo. His wife Fanny and I spoke. They're from Old Bridge. Nelson was only 44 years old, member of PBA 105. He leaves behind his wife Fanny, their 3 kids who are 18, 13, and 12. awful, a guy who's left us far too soon. Mahan, even though I'm speaking about him today because I just connected with his blessed wife, maybe we can have a picture of him tomorrow, if we could, just to make sure everybody puts a name with a face. I also spoke with my fellow Middletown resident, Bill Sullivan, who was not only a friend of Nelson's, but is the president of PBA 105. To Nelson, his memory, his wife Fanny, their 3 kids, to Bill and all their colleagues, our thoughts and prayers and hearts go out to you. So in that respect, today I am signing an executive order to help preserve this balance between health on the one hand and public health and public safety on the other. Under this order, certain low-risk individuals whose current age or health status puts them at particular risk for COVID-19, who had been perhaps denied parole within the last year, or whose sentences are to expire within the next 3 months, may be placed, and I say maybe, on temporary home confinement or granted parole if already eligible through an expedited process. And I want to stress that no one convicted of a serious crime, such as murder, sexual assault, among others, will be eligible for consideration. We are setting up a robust process through which each potentially eligible individual must be determined to be safe to place on home confinement, and each will be required to have an individualized release plan to ensure they will have access to all necessary services, medical services, and housing. No one who cannot meet these standards will be released. Individuals on home confinement will be subject to Department of Corrections supervision. As I noted, we have dual or twin responsibilities here, protecting those who work in our prisons and those who are incarcerated. Social distancing is extremely hard to accomplish in a prison setting, and allowing some of our most vulnerable individuals who do not pose a public safety threat to temporarily leave prison will protect both their health and the health and safety of the men and women working in our correctional facilities. And by the way, we're not the first to do this. New Jersey will join several other states. Some of the big ones are California and Illinois, and the federal government, by the way, which have taken similar steps. And again, I want to give a big shout out to Marcus and his team, who have been mightily trying to stay out ahead of this challenge. Again, when you've got concentrated communities from day one. And this is a big, important step to help to allow them to continue to stay out ahead. I also want to acknowledge the Director of the Department of Homeland Security and Preparedness, Jared Maples, Deputy Counsel Paramount Garg is in the House with us as well.